experience on non-invasive brain stimulation for chronic pain syndrome. As Florent mentioned, my background is anesthesiology, but I completely quit anesthesia now since almost 4 years since we opened this new pain clinic in Latour Hospital. And now only dedicate my activity to chronic pain management. As Florent also mentioned, we use and we started with magnetic transcranial magnetic stimulation about 10 years ago. And so we build quite a good experience, but I'm gonna mainly present during this lecture result from the literature because we use it a lot, but unfortunately we did not publish a lot about that till now. We use it, I would say, for the 3 or top indication for our chronic pain management would be number 1, LTMS for fibromyalgia patient. Number 2, I would say for CRPS, complex regional pain syndrome, type 1 or type 2, mainly on the upper limb, the CRPS of the hand. And we also treat quite many patients for neuropathic pain syndrome, either central neuropathic pain like post-stroke, chronic pain, or post-spinal cord injury, neuropathic pain. We also have some peripheral neuropathy pain, like, for example, diabetic painful neuropathy. So I'm going to present, and I'm going to mostly focus on those syndromes during this presentation, and we're going to save some time at the end for the question and the discussion. So maybe the first thing I would like to highlight, when you propose or when you talk about non-invasive brain stimulation to your patient for chronic pain, I think the first image or the first thing they have is this kind of a picture. They imagine something from one flew over the cuckoo nest, or this picture, this strange helmet in Back to the Future, all this strange kind of electrical stimulation of the brain derived from the scientific or sci-fi movie. So one thing which is very important is just to explain them the principle of the non-invasive brain stimulation, and maybe to remind them that it's completely non-invasive, that it's usually non-painful. There is very few side effects. And I think since the time we started 10 years ago, we didn't see any major side effect. We never saw any epileptic seizure or crisis, which is the most fear complication of this technique. But personally, we never saw one of these during these last 10 years of practice. It's also important to explain them the very few contraindications if the patient, of course, is wearing some cochlear implant, or if there are metallic foreign body in the brain or in the eye. It could be absolute contraindication to perform magnetic stimulation. Alcohol or drug abuse, or pregnancy, or again unstable epileptic state could be also a contraindication. In our center, we use mainly 2 techniques. The repetitive transcranial magnetic stimulation, RTMS. We use exactly this kind of device. It's non-navigated. We use the electrical potential to just localize the motor cortex. And we also use transcranial direct current stimulation, tDCS. We do it on site in the clinic. We also try during a short time the device that is portable, then the patient can do it remotely at home, but there is still problem of reimbursement. So now we focus on this technique on site in the hospital. I'm going to also say a few words maybe on the cranial electrotherapy stimulation, the KES, that we also use in some indication in fibromyalgia, for example. And we're going to see that the result is not that good, or the evidence is not that good.